Hey, my name is Lindsey. I've been asked by Miss C to talk to you guys a little bit today about navigating the mental health system. So I'm going to try to summarize in the least boring way possible how you can get mental health treatment for yourself or someone that you love. So first of all, before I say anything about getting services or getting treatment, I want to first normalize any mental health problems that you may be experiencing, whether they're mild or severe. I want you to know that even if you don't know anyone else experiencing this, what you're going through is very normal and you're definitely not alone. To give you just the tiniest little background on myself and why these topics are important to me and why I know a little bit more about them, I am an intensive case manager for children and teenagers with mental health cooperative. I've been doing that job for about 4 years. I also have my temporary therapy license, and by the end of this year, I will be a full licensed therapist. So mental health is very important to me as far as my career aspirations go. And I've also struggled with my own mental health stuff that has encouraged me to help others. Okay, so let's just get right down to it. Unfortunately, before I can direct you in one way or another about how you should seek out your mental health treatment, we're going to have to talk about insurance. So you may know what kind of insurance you have. You may have to ask your parents, but there's two groups of people we're going to be talking about here. First, I'm going to start with folks who have TennCare. So if you have TennCare, your health insurance card is probably going to say one of a few things on it. It will likely say Blue Care, United Healthcare, AmeriGroup, or maybe Covered Kids. So if any of those ring a bell for you, you have TennCare. If you have TennCare, one place that you'll want to start is probably a mental health nonprofit. Think Mental Health Cooperative, Centerstone, Omnivisions, Youth Villages. You may have heard of some of those places. The great thing about going to a mental health nonprofit is that it is no cost to you. You're never going to have to pay anything. It's a service provided by the government, and it's wonderful. It's full of a lot of caring people like myself. So you may be familiar with some of these nonprofits that I just mentioned because maybe you've had a case manager in the past like me. If so, that's great. If not, I'll tell you a little bit about how, from my knowledge, how these nonprofits work. They'll likely have 3 main people that will work with you if you want to do all 3 parts of these services. The first is a psychiatrist. A psychiatrist is not a therapist. A psychiatrist is a mental health doctor that will talk to you about what your symptoms are, what you would like to improve, and what kind of medication they can prescribe to alleviate some of those symptoms you're experiencing. You can talk to a psychiatrist a little bit about, the background of what's going on with you, but really they're a medical doctor. They want to measure, are you improving? Are you having symptoms? Are you getting worse? So a psychiatrist is going to take care of those things. And then next up, after the psychiatrist, another key part of a mental health nonprofit organization is the therapist. The therapist is somebody that you could meet with weekly, bi-weekly, once a month. And a therapist is really going to get to know you a little bit deeper. They're going to learn more background about you, your family, whatever these specific situations are that are really bringing you down and causing you problems in life. And they're going to help you come up with strategies to deal with that better. They're not going to give you advice and they're not going to tell you what to do. They're just going to help guide you to figure out what is the best for you. And then we have the caseworker, which you may already be familiar with. The caseworker is, think of it as your own personal social worker. So this is someone who is going to provide you community resources to fill in any gaps in your life or stuff that's missing. So it could be food, it could be money to help pay for bills, it could be just advocating for you at school if you feel like you need extra help, or maybe an IEP. A case manager / social worker is also kind of like a therapist that can just kind of work through daily, just the daily problems that we deal with every day. I'm having a hard day today. This is what's going on. This is how I got into this fight with my parent or my best friend. And that person is a mental health professional to the degree that they can help walk you through things and figure out what worked, what didn't work, what we can try next time. So a social worker or a caseworker is somebody that you're going to spend probably more time communicating with, depending on the level of case management services that you receive. Most case managers will just talk to you a couple times a month just to check in and make sure there's nothing you need. And if you have an intensive case manager like myself, we could talk as often as once to 3 times a week. Now let's talk about the folks who don't have health insurance at all. So you don't have TennCare, your parents don't have private insurance. If you don't have health insurance, don't panic, there are options. I can't speak for other nonprofits, but I do know that Mental Health Cooperative has a program for people who don't have insurance at all, and it's called Safety Net. Safety Net can even help you get insurance if you just need help doing the paperwork and talking with the people. But the Safety Net program is there specifically to be a safety net for people who don't have insurance and can provide all of the same mental health services to you that we've already talked about. So if you don't have insurance, it's okay. Let's just find out if the organization that you want to work with has a free program like Safety Net. And I'm sure that we're not the only ones who have it. There's got to be other ones out there. So it never hurts to ask. Okay, so now, what if you have private insurance? Private insurance is usually health insurance that's coming through your parents' job. So it could be Cigna, Aetna, UMR, what are some others? Blue Cross Blue Shield. There are a lot of different ones that are just private, for-profit insurance companies. If you fall into that category, there are a lot of options for you as well. So you could start off by looking at the number on the back of your insurance card. You can call in and there will be somebody there on the line who can direct you to local therapists, psychiatrists who are in your area, in your network, and who are taking new patients. So that's one place to start. Another place, if you have private insurance that you can look, and maybe even if you have TennCare, is a website called psychologytoday.com. Psychology Today is a huge database that I know lots and lots of therapists in the United States advertise themselves so people can find them online and start therapy. This is actually where I found my therapist. Shout out Linda. And the cool thing about this website is that you can narrow your search based on the type of insurance you have, the gender that you prefer your therapist to be, and if they have any specialties. So if you want to talk to a therapist who specializes in sexual abuse, LGBTQ issues, depression and anxiety, OCD, there are therapists out there who specialize in just those areas, and that way you can really spend time on this one particular topic that is the most relevant for you. Now, if I've overwhelmed you with all of these different treatment options with psychiatrists and therapists and caseworkers, I totally understand, because I know that this can sound like a lot. If you don't feel like you're ready to jump into all of that just yet, you can always start at your primary care physician's office. You can tell them what your symptoms are, how you're struggling, and if they feel like they can adequately address those problems with medication, they can write you a prescription for medication they feel like is appropriate. PCPs are not necessarily mental health professionals, but they've studied enough on the topic to know what kind of medications work best for certain kinds of struggles. Now, I will add this caveat: medication is not going to help long-term for really deep-seated issues if that's the only thing you're doing. Studies have shown that medication and therapy is the most effective combination for getting around these mental health struggles that really bother us the most. And then I also know that some people are very anti-medicine. They don't want to take medicine. They don't want to feel like they have to depend on a pill to help them feel better. For those people, I say, it's your body, it's your choice, and I totally respect that. I'll also add that medication doesn't have to be a forever thing. Think of medication as a temporary helper to get you to a stable place mentally so you can learn how to cope better and deal with life better. Life is hard. Y'all know this. Life during COVID is hard. So if medication can get you to a place of equilibrium so you can learn to take better care of yourself, practice better self-care, communicate your needs better, cope better so you're not using bad coping skills that are harmful to you. If medication can be that temporary bridge to get you to that next place, that better place of functioning, by all means. Science is awesome. Let's take advantage of the tools we have. But all of that to say, if you are super uncomfortable with the idea of taking medicine, or if there are religious or cultural things that keep you from wanting to take medication, I absolutely understand and respect that. Maybe seek out a therapist, and it could do the trick for you. Maybe just getting that added support and learning to know yourself better through therapy can help you to get to this better, more stable place so you're functioning better and you feel like your mental health is better. Now, as I wrap up this video, I want to address two specific populations that are especially meaningful for me. If you are a person who is dealing with suicidal thoughts, ideations, or self-harming behavior regularly, let's bypass all of the red tape, the therapist, the caseworker, all of that. Forget all of that. Let's get you help immediately. Let's get you help today. I'm going to include some phone numbers that you can call and text so we can start working on keeping you safe today and keeping you here on this planet with us. No matter what your brain is telling you right now about how you don't deserve to be here or you're a burden, I promise you that is not true. As someone who has lost someone to suicide, I can tell you the world is a better place with you in it, and in your absence, there would be people who would suffer from missing you every single day. So if you are contemplating suicide, if you're self-harming, if you feel like your suicidal ideations are escalating, let's get help for you today. Let's get you to a mobile crisis center. Let's call or text somebody who can help. And let's get you on the road to feeling a lot better so you can begin to live life again. And if you identify as a member of the LGBTQ+ community, there are a lot of resources out there, yes, even in Tennessee, even in the South, for folks like you. So, shameless plug here, if you do identify as a member of the LGBTQ+ community and you're interested in group therapy, I do run an LGBTQ+ therapy group for teenagers at Mental Health Cooperative. If you were to enroll in Mental Health Cooperative services, I would love for you to join our group. If you would like to seek out some different services, there are options as well. If you've heard of the Oasis Center, they have an excellent LGBTQ+ therapy group called Just Us. You may have heard of them. Vanderbilt University has their own division of the hospital and the university that's dedicated to LGBTQ+ therapy and medical treatment like hormone therapy. And if hormone therapy is something that you are interested in, so you can get your body to match your gender identity, there are a lot of clinics in Tennessee that we can direct you to as well, who can help you to do those things in a safe way. So, like I said, these two populations, people who struggle with suicide and also the LGBTQ+ community, are two groups of people that are profoundly important and personal to me. So if you fall into either of those categories, I hope that you will reach out to me, Mrs. C, your guidance counselor, or any other support out there so we can get you directed to some resources and supports that would help enrich your life and make it better. So y'all, that is my quickest summary of all of the information that I felt was the most important to share with you today. I hope I answered some of your questions. I hope I said this in a way that was easy enough to understand so it was a little less overwhelming. If you have any questions, I'm going to give my email address out to y'all, so feel free to email me anytime, and I'll get back to you as soon as possible. Thank you for listening, and there might be a part 2.